Good morning, everyone. We are here at Way Down Yonder on Main Street in downtown Columbus, and we really want everyone to understand that this is a beautiful morning. It's a great day to talk about a very serious subject. But first, we want to get started with the venue that we are located at. This is a restaurant that's been in business for a while. However, this is the new location for the restaurant called Way Down Yonder. And I'm going to let, well, the music keeps interrupting me. I'm going to let Leslie London, who is the executive assistant and events coordinator for Way Down Yonder, to come and talk about this restaurant and why we are here today. The other reason I wanted to let her come up and talk about the business is because one of our goals of having these quarterly community health advocacy breakfast forums is to expose our community to racial, ethnic, and women-owned businesses because we want people to understand that we've got all kinds of businesses in our community and we want to lift them up. We want to make sure that we are patronizing them. And this gives us an opportunity to expose them to a wider audience. So if Leslie would come on over and she's going to give you a welcome and some more information.
Good morning, everybody. Thank you guys so much for coming out this morning. My name is Leslie London. I am Yonder's executive assistant. She sends her best regards. She unfortunately could not be here today. We all kicked her out. She is on a well-deserved vacation. She is getting some R&R. So I'm holding it down for her for a little while until she gets back. So this is Way Down Yonder. I'll give you a little history about it. We are from New Orleans. She is my bonus sister. I have been blessed enough to integrate myself into her family. Yonder has been here for 20 years. She started working out with her mom. She comes from a line of entrepreneurs in her family. So she was pretty destined to be here. We didn't know she would be at this location, but she was pretty destined to be an entrepreneur. Her mother she actually started, helped her mom open a restaurant called Way Down Yonder. So that's where it actually started, which is open now. It's 3847 South High. Got to plug mom in. Mom sells food. So if you ever want New Orleans gumbo, etouffee, crawfish etouffee, po' boys, you can see mom down. She actually has her own line as well. If you guys have never been to New Orleans, we kind of decided to bring New Orleans to Columbus. So you're not missing anything if you've never been to New Orleans. So Yonder actually helped mom get started. Once mom was able to get on her feet and take the helm, Yonder kind of backed off. Yonder actually used to sell cakes. So she would sell mini cakes, strawberry, fried Oreo. She had a variety of cakes she would sell. So once she backed away, she came up with her own vision that she would sell beignets. So beignets is a staple that we have back home in New Orleans. And if you think of it, I always like to explain it to people. It's a fried funnel cake with powdered sugar. We have some in the back. If you guys have never had some, you can absolutely sample it. But it's really a fried dough. Fried piece of dough, we put powdered sugar on it. Yonder, however, I call her a little mad scientist, was smart enough to come up with a concept where she took all of the cakes that she had, she turned them into beignets. So now she has strawberry crunch beignets and fried stuffed Oreo beignets and banana foster beignets and pecan praline beignets and glazed beignets. And that's every single cake that she sold at mom's restaurant, she turned it into her own brand. So I'm super proud of her. We have been in business for a year, actually. She was able to open it up in the midst of COVID. And we are grateful and blessed that we are still able to sustain. We are super excited that you guys are here. If you have never been here before, welcome from the bottom of our hearts. We are so humble, so grateful that you guys are here. Thank you so much for having us. We get emails all the time And we didn't know, I like to do my research because I'm a nurse by my trade is a nurse. Yes, ma'am. So, I'm always in that assessment mode, like, ooh, let me see primary. Ooh, that's up my alley. Like, and congratulations to you too for being the CEO and taking over this position. I think that is so awesome. But I welcome you guys again. I also want to shout out our team. This is a family-owned business, obviously. The handsome gentleman right there is my nephew. That's actually Yonder's son. So if you ever stop by and get our breakfast beignet, he is the mastermind behind that. And then Miss Kim, that is my sister. That's our sister. That's Yonder's sister. She is the friendly face that will greet you. And then Leslie is in the back. She helps run everything and cook everything. So again, thank you guys so much for coming. We truly appreciate it, and we hope you enjoy our food and our hospitality.
Thank you very much, Leslie, and thank you for opening up the restaurant for us today. And I learned something new. I thought that the Way Down Yonder on South High was going to replace that location. So there are two locations that you can visit and participate and share with your friends and family because, again, two women-owned businesses. And so we are very proud of the women who have started these two restaurants. I'm Charlita Tavares. I'm the CEO of Primary One Health. I neglected to introduce myself at the beginning, but we're very proud to be here today. We've got a very serious topic to talk about today. The title is Justice or Just Us, Policies and Programs to Improve Our Justice System. And we chose that topic because there are so many issues that we have to take into consideration when we talk about the criminal justice system. And we've got experts from various areas of the criminal justice system that are going to present today. I'm going to start with Chenelle Jones. Is she here? I don't think she's here yet, so we'll go to the next speaker. We can be a little flexible. Ruchelle Pride. I know. Ruchelle Pride, she is the director of the Franklin County, and let me go back a little bit. This event today is jointly sponsored by Primary One Health and Franklin County Public Health. I want to thank Joe Mazzola, who is the health commissioner, who really reached out to me and asked if they could join in these quarterly community health outreach breakfasts, because they didn't want to duplicate something that was already taking place, but they really wanted to address the social determinants of health. And that's why they are jointly sponsoring these events with us. And so as a part of our family of Franklin County, we've got Ruchelle Pride, who is the director of the Office of Justice Policies and Programs. And she is going to share her perspective and some of the programs and services that Franklin County is offering for our justice-involved residents of Central Ohio. Ruchelle, come on up, and you can take more time to introduce yourself. Let's give her a round of applause.
Good morning, everyone. Thank you so much for the opportunity to be here today. Thank you to Primary One Health, Franklin County Public Health, who our office works very closely with, as well as a lot of other community partners. I won't start trying to list all of our partners because they'll throw tomatoes at me because I'm going to forget somebody. So the good thing is that, again, we have our partners because this work of addressing our system, specifically our justice system, cannot be done alone. It really, truly does require all of us. So as introduced, I am the director for the Franklin County Office of Justice Policy and Programs, as well as CASA of Franklin County. CASA is under the umbrella of Justice Policy and Programs, and they are our court-appointed special advocates that go into our courtrooms in juvenile court to advocate on behalf of abused and neglected children. So one of the things that our office focuses on is making sure that we begin to look at the ecosystem of justice here in Franklin County. So we serve as the Criminal Justice Services Agency to our Franklin County Board of Commissioners. We support strategic planning, We spearhead several initiatives. We offer technical assistance. We do system-wide data sharing and data gathering to really make sure that we are ahead of the curve as it relates to what needs to happen in justice. One of the things that I understand is that for the work that we do, we really focus on truly, as we know, Franklin County's motto is every resident, every day. Those that are with us in our communities, but of course, those that are with us in our justice system. One of the things that I also believe wholeheartedly is justice for all, justice not specific enough. There has to be a reality of what does that really mean and what does that really look like for those that we serve. So our office also makes sure that we serve as that fiduciary agent to the Board of Commissioners, and we allocate a lot of federal, state, and local funding to make sure that internally our operations are supporting what we need to do in the space, but also, again, that our community partners can do the same. We also serve as the administrative agent to the Franklin County Criminal Justice Planning Board and the Reentry Advisory Board. And so through this work, we are able to consult, again, plan and develop projects on a national, state, and local level to ensure that we're really looking at the justice through the lens of smart justice. So as we talk about really the focus of mass incarceration, I kind of want to give a backdrop to that because our services and our programs that we facilitate inside of our jail facilities and even now stretching into our state facilities is focused on meeting people where they are to help them navigate that next step. One of our largest initiatives that we have under our office is reentry. And we believe that the best reentry is actually no entry at all. So if we can be preventative, if we can focus on what is the critical need of an individual in our community before they are criminalized, we don't have to criminalize people in order to help them. But oftentimes what we see in our system is that we wait until, even from young people, with our juvenile justice system, as we look at juvenile justice, common police court, municipal court, we look at the entire justice ecosystem, and what we find is that we have been putting a Band-Aid on things that require surgery. Our children are integrated into a pipeline that is very, very real. And so for a lot of our young people, we see these behaviors that start to happen at a young age, but we wait until they get to an age where they can be criminalized and they can be given a rap sheet. And then we say, what is it that we need to do to address this? And then even in that moment, we're looking at our young people as a singular person, as if there's not a family system connected to that child that then also needs the same level of support. So when we're looking at this, we're looking at it literally from day one to where we end up and where our systems default into the business of mass incarceration. And so looking just at I want to be able to share some points with you that I think is very critical to frame this conversation, is looking at what mass incarceration truly is. The United States currently has the highest rate in the world, both per capita and by volume, of those who are incarcerated, making up 20% of the world's population of people that are in prison. At the end of 2019, the imprisonment rate among Black men were nearly 6 times that of white men. And the rate of Black women have doubled since that as well, compared to white women. And lastly, the United States spends $80 billion on incarceration. $80 billion. And so for the state of Ohio, let's bring this into where we reside as a state. Ohio spends money on 3 things. That's education, medication, and incarceration. When you look at where the money goes and how we navigate with individuals who, again, have encountered our systems, one thing I can assure you is that a person did not wake up one day and decide that their life goal and career was to be a prisoner. That's not what happened. A person does not wake up and decide to be penetrated into a system and recycled through that system, because our country has a debilitating disease of treating people as property. And so we know, as we talk about, we can't really get into the crux of where we are today without understanding where we've come from. We talk about social determinants of health, but there are structural determinants of health that then in turn has impacted our social determinants of health. So we're talking about from slavery to Reconstruction to Jim Crow to civil rights. There are things that we know that have basically bled down through what we now have as a system that is very fractured. And so when we talk about policies and programs, what we like to do when we're talking with our residents who have been impacted both inside the facilities and away from the facility is that we really try to look at this through an umbrella of a human-centric approach. We try to make sure that our programs actually become a practice. The things that we should have been doing anyway, because that's what we should have been doing anyway. And so when you develop those programs, we try to make sure that then we infuse that as something that is a systematic change, not just a programmatic thing that phases out and then eventually we have to create something else and then create something else. So what we've done within Franklin County in our ecosystem as well to address some of the preventative and intermittent responses, intervention, as well as, of course, the reentry aspect, is we have developed under our Board of Commissioners and Deputy County Administrator Joy Bivens, the Health and Human Services pillar of Franklin County. And what that is comprised of is the Office on Aging. We have Director Wingo in the back for our Office on Aging, Child Support Enforcement Agency, as well as Job and Family Services have come together to join forces with the Office of Justice Policy and Programs. And what we've done is that we focus on a more intentional way in service, because what we realized is we were serving the same people. We were over-applicating, over-processing the same people, yet they had to go 50 different ways from Sunday to get to the same point. And so the focus was, how do we align so that way we're more outward facing, we're more intentional about what we're doing to our residents, but also working with them to navigate these steps. And then how can our systems align behind the scenes to make sure our processes are changed, our policies are changed, that we're looking at how we can disrupt these barriers that our systems have perpetuated and created. So with that work, another one of our biggest initiatives has been youth of incarcerated parents. Because again, when you incarcerate a person, you incarcerate a family. And so what we were able to do with Judge Page's blessing and immense support is, one of the things that we realized is that before we sentence somebody to incarceration in our court systems, we ask them about 1 million questions in court. And one thing that we neglect to ask is, do you have children that are being left behind now that you're going to be incarcerated? And so what we wanted to do is be able to stop the bleed from what we already know incarceration does and wrap around that family now that that individual is going to into a system of incarceration. We wanted to make sure that we wrapped around that. So what we did was we instituted a specialist that would be in the courtroom, that at the time of that sentencing, that individual could be able to speak with someone directly and say, yes, I do have children. Yes, there is someone left behind that's going to have to care for my children while I'm gone, and they're going to need some things. And so with that, our specialist is able to connect with the resident and their family. And as we did this, we launched Youth of Incarcerated Parents in July of 2022. And to date, what we noticed with our data was that 64% of the caregivers left behind after incarceration were Black women, left to raise children. And we realized that the remaining portion were grandparents. We have a lot of grandparents raising children who are impacted, because the family was impacted by incarceration. And so with support from our Office on Aging as well, we realized that we need to make sure that we're wrapping around those grandparents that have those children and making sure that there's connectivity all the way through the process. So that way they have what they need to support the child, and the child also has what they need. And so as we're building out our programs, and we're focusing even again, on our young people as young as kindergarten, what we really want to help people understand is that unfortunately we have been attending a silent graduation. And the silent graduation is children who end up abused and neglected, end up having to combat with parental incarceration and other factors that impact their social determinant of health. These young people sometimes graduate into the child welfare system, then they graduate into the juvenile justice system, and then they end up in the adult system. And the only thing that we give them, the piece of paper to show where they transition through, is a rap sheet. That's not a graduation I want to keep showing up at. And so at the end of the day, we want to make sure that we are, again, as preventative as possible as we talk about policies, as we talk about our procedures and what mass incarceration has done to this country. What we focus on is everything from sentencing reform to prosecutorial reform to reentry. We have to look at our bail policies and practices, probation, parole. All of those things are what our office is responsible and charged with in making sure that we're effectuating smart justice that will decrease the number of individuals who are incarcerated, and also looking at making sure that there's mechanisms in place to facilitate that. One of the things that we were also able to do in December of 2022 is we were tapped by the Department of Justice and the Bureau of Justice Assistance, as well as the Council of State Governments, to adopt an initiative called Justice Counts. Justice Counts looks at all of those domains I just listed, from reentry to probation to parole, bail reform, sentencing. We look at the data from all of those various arenas, our courts, our jails. We're looking at the prosecutor's office, the public defender's office, our probation and parole, and we're creating a data hub where we can actually look at what is really happening in our system. We see what the media portrays, but we know that's just one part of the story, right? We really want to make sure that we're infusing ourselves in data-driven decision-making, and that the things that we're working with our criminal justice planning board to wrap around, our reentry advisory board, that it's all making sense. But one thing that we also do not leave out of this is the voice of those who are impacted. We have to stop telling people what they need rather than listening to what they need, because they are those that are experiencing this bleed out. And so with Justice Counts, that allowed us to be the first local entity in the nation to adopt Justice Counts. And that required there to be an agreement with our law enforcement and all the different divisions of our justice system, that they agreed through a memorandum of understanding to participate with us in really trying to move the needle to dismantle the racial inequities and other things that we experience in our system. A lot of the work that we do is, of course, very much fashioned around our 2019 Franklin County Rise Together Blueprint. Everything that we do, our blueprint can be found online on our Board of Commissioners website. Everything that we do in our agencies, within our Health and Human Services pillars, as well as our other county agencies, is to make sure that that blueprint truly is our map, our roadmap, to make sure that everything we do is effectuated through what the people's plan is, what we refer to the blueprint is. This is what the community said they needed. Our community said that we need to support, and how we can best support them. And so making sure that their voices are heard in every step of our programs, our policies, and our processes became the crux of what we do. In 2019, our Board of Commissioners declared racism a public health crisis, because it is. It is truly an impediment of health, the quality of life that we experience. And so when we're impacted by the isms, is what I call them, we have to make sure that we understand that there are some things that we have to do differently than what once done before. Doing things the way that we've always done it, that's just what we've always done, is harm people way more than it's helped them. And so there's a responsibility that we have when we're talking about this. So again, we continue to forge our partnership with the State Department of Corrections. We actually go into the institutions, we talk to men and women, we hear their voice, we give them empowerment and encouragement as they go through this journey of incarceration. One last data point that I want to give to you is that 95% of our individuals in Ohio State prisons are returning back to the communities they left. 95%. However, because we have this disease of treating people as property, we warehouse them and think that they're just away, tucked away, out of sight, out of mind, and that they're never coming back. 95% is a lot of people. Everybody who's in prison is not Jeffrey Dahmer or Ted Bundy. Okay? 95% of those folks that we lock away are coming back home. And it's our responsibility and our accountability to ensure that they are equipped to be better than they leaving than what they were going in. And so that's why with our state prisons, we explain that reentry planning starts the moment you get a person. If I've been locked in down 5, 10, 15 years, there's a process that I gotta go through because times have changed. So we just really wanna make sure that as we're looking at this, please reach into our office. If you're interested, if you can support us, I'll put in a shameless plug. My CASA volunteers or thebomb.com. CASA supports our children. We need volunteers that represent the children that we serve. So if you're interested in volunteerism with CASA and really being engaged in the work that we're doing, we strongly encourage you to be a part of that. And what I will leave you with is a quote that I really want you to hear, because it is truly, to me, indicative of what we do every day when you are in public service. How you see people is how you serve people. So if you see somebody as less than, you will inevitably serve them less. If you see them as more, you will give them more. See people as that, and we'll be better for it. Thank you.
Well, let's give Director Pride another round of applause. We shared some very valuable information and things that I think a lot of us just don't think about day in and day out, but we are thankful that you are thinking of them, you and your team at the Franklin County Office of Justice Policy and Programs. We're going to move to our next speaker, and this person is someone that's close to me in a number of ways. She served on Columbus City Council, which many of you know, I served on Columbus City Council. She also goes to my church. We both go to the same church. And she is a young woman that has really blossomed, not only while she was on Columbus City Council, but now as a judge with the Franklin County Common Pleas Court. And so I want to bring to you now the Honorable Judge Jaiza Page. Let's give her a round of applause.
Good morning, everyone. Now I know how people feel when they say they don't want to follow someone and speaking. I definitely will never become after director pride on an agenda. But again, good morning. My name is Jaiza Page, and I am a judge in the Franklin County Court of Common Pleas General Division. And I would first like to thank, I will always call her Senator Tavares. Just thank you for your passion and the work that you continue to do in the community. And I would also like to, there's one more person I wanted to shout out. And so I call her Auntie Evelyn. And I, wave your hand. So I want her to stand and wave her hand because she was the first Black woman attorney that I knew. I've known her my entire life. And it's not just the representation, but she showed me through her work and what she did, what it takes to be a successful minority woman in the legal field. And I just want to thank you publicly. And I appreciate all that you have done in the legal community here in Franklin County, but also for me personally. So thank you. Just a little bit about me. I was born and raised here in Columbus. I lived primarily in the Linden community until I was about 16. And then my mom moved my brother and I to the east side of Columbus. I say I was blessed with the opportunity to attend Columbus School for Girls for my last 2 years of high school. Once I graduated there, I went to Georgetown University and then moved back home to attend the Ohio State University Morris College of Law. I knew since I was 8 years old that I wanted to be an attorney. And really, I would have thought that I was going to go into family and juvenile law because I was watching a TV show and there was a child, his parents were getting divorced, and the judge said that this kid needs an attorney because the parents were going back and forth. And so I said, I want to do that. I want to be able to help kids in the courtroom. But as I got older and just thought about different things, my lens changed. And then I kind of wanted to go into education and school law because I'm very passionate about young people and ensuring that they are receiving the proper education within their school system. I graduated from law school and I was actually given the opportunity to work in the Columbus City Attorney's Office, and I was in the zone initiative. So a lot of the work that we did, which was then Commissioner Kathleen Bailey, Area Commissioner, was working in the communities within the city of Columbus to ensure that any vacant and abandoned house was properly secured, any place where they were selling alcohol to minors, selling drugs or any type of illegal activity would get shut down. So I did that for 4 years, and I began to see our community in a different lens. And I began to see that no one, regardless of their area code, should have to live in a substandard living condition. And through that work, I was appointed to Columbus City Council. I was then later elected that year and learned a lot about how our local government works, but also a lot of the issues that our residents face. And for me, healthy children or healthy families create a healthy city, which creates a healthy state. And so as local leaders, we have to focus on what we can, which is those healthy children and those healthy families. And that's a huge ecosystem of a lot of different individuals, from healthcare to the judicial system, to education, to mental health, that we all have to work together to ensure that those children and those parents and these neighborhoods are safe and healthy. I missed the courtroom, and so I decided to run for the court in 2018 and was elected and have served on the Franklin County Court of Common Pleas General Division since January of 2019. So I'll share with you a little bit about our court. How many of you watch like Law and Order or any type of those shows? Yes, I do too. So that is the type of court that I serve in. So I am in a trial court. I am the judge that is receiving evidence in order to make a determination of whether one is guilty or not guilty. And actually in the legal system, we don't use innocent. We use guilty or not guilty. The other trial courts are like the municipal court, which handles adult misdemeanors. The juvenile court is a trial court in a sense too. And then The jurisdiction of my court is adult felony cases. So anyone who is 18 years and up who has committed a felony. We handle juvenile bindovers, which means that a juvenile under the age of 18 is going to be tried as an adult. And we also handle civil cases that are typically $15,000 and up, which means that one party is suing another party for a minimum of $15,000. It could go up to $2 million. And I would say for the juvenile bindovers, I know that a lot of times makes people nervous because you have young people who are going to progress through a system as if they are adults. And we understand that they don't have the same decision-making capability as like Director Pride was talking about. What type of environment did they grow up in that led them to make a decision at the age of 16 that unfortunately impacted someone and may have taken their life? And so I would say that here in Franklin County, I believe that our juvenile judges do an amazing job at trying to determine who should be bound over to the adult system. So there's the mandatory bindovers and discretionary bindovers. Mandatory bindovers are that in which the judge does not have the discretion to determine whether or not this child has to go through the system as an adult. I've been on the bench for 5 years. I have had 3 juvenile bindovers. So when you think about the amount of time, that's not a lot. And one of them, the charges were dismissed after additional investigation. There is one right now who is still currently going throughout the trial process. And then another young man who pled guilty. He was 17 and is going to go to prison. I did learn actually this past week that the Ohio Department of Rehabilitation and Corrections keeps all of the juvenile individuals together. And so there are about, I believe, 20 of them right now that are at the reception center, and they have their separate quarters. They are stay there until they're 18. Once they turn 18, they're given about a 6-week kind of training period to get them acclimated to what it would be like to be in prison with adults. But I do believe that there are efforts to ensure that although this young person has made a bad decision, they are not a bad person. And in the time that they are incarcerated, that they're going to do what they can to ensure, one, that they are safe, that they have the skills that they need to do well while they are incarcerated, and then hopefully acquire the skills that they need to be members of society and to do well. So I have had individuals that I have released early from prison who went in as very young people, whether they were 17 or 19. 19 is still pretty young, and have thrived in our community and are doing very well and are, giving back to the community in very different ways. So to talk about some of the programs that we have in our court. Last year, our administrative judge of that year, Kimberly Cocroft, started the Access to Justice Committee. And so that has been integral in really helping our court reframe the way that we think about the individuals who come before us and really the resources and services that we are providing. So I've been excited to be the pilot courtroom for the youth of incarcerated parents. And Director Pride was right. Many times we don't ask them, do they have any children at home? And they would tell us during their, when they're talking to the court, that they're leaving behind children, but we didn't have anything in place other than, an internal feeling that, I'm sorry, your children will be without you for a period of time. But now through the Youth of Incarcerated Parents, they're doing amazing things, helping with mothers and grandparents who need help with rent. And that's not just if they're going to prison, but also if they're going to be in jail for an extended period of time. Ensuring that those young people have any resources that they need, from educational resources to social services. So again, while they have one or sometimes 2 parents who are incarcerated, they're not lacking in anything that they need to be productive individuals and continue to strive in their lives. So it's been exciting to be a part of that program. I know a lot of times people are like, why is she asking me, do I have kids? Because it's a new, it's a new thought. And what do you want to know about my kids? And then I say, well, who are they in custody of? Do you have their phone number? You'll be shocked sometimes they don't even have that contact information. They just have a name, and then Director Pratt and her team, they're searching to see if they can find this person. But I did have, depending on how long their sentence is, when they have come back, they have shared that they appreciate the work that was done to make sure that their girlfriend or their wife was housed throughout the time that they could not provide that additional income. As also with the Access to Justice Committee was the implementation of online payments to pay restitution and court costs. And so some may think, why does that matter? It's not really a big deal. But it does really provide individuals with another opportunity to pay their court costs, to pay their restitution, and not have to come down to the courthouse again, which can be another burden for a lot of people. And also, they don't have to necessarily call in, because the options we have are come down to the courthouse, or you could call the clerk's office. And many of us, when we're paying bills, if we had to call every month, if we're not putting a reminder, it's not something that you remember. But if you have the ability to just take your card and you can make this payment online, then you can do it at any time and without that additional just hassle of trying to remember or get down to a certain location. So that was implemented last year. It's fully functional. It was a partnership with the Franklin County Clerk of Courts. So you can find it on their website. It's not on the court's website, but that's something that we want to make sure that people are utilizing as well. The court voted to expand our budget to create a DEI director position for the court. Right now, we have a DEI manager who works primarily with our probation department, because as we know, our probation officers are the ones who are out in the community. They are dealing with the individuals who have been sentenced to a term of probation or community control. And so we want to make sure that they understand to the best of their ability the individuals that they are working with so that they can serve them to their highest capacity. So now we're working to have this hopefully court-wide, because we know that there's just a lot of things that the justice system can do in order to make sure that when we see someone before us who doesn't look like us, who doesn't speak our same language, that we're not taking those things into consideration when we are imposing a sentence. We have also, this year, some of our criminal forms are now going to be translated into 3 different languages, which are Spanish, Nepali, and Somali. We have done that because we go through the forms, we'll go through a plea form, and we all have 6 constitutional trial rights. How many of you know all 6 of those constitutional rights? Not many people. And imagine if you come from a country that does not have these same rights. And so I'm explaining to you, and you come from a country that does not have jury trials of your peers, that you have the right to have 12 people sit over here and to determine whether you're guilty or not. And I'm explaining it in English. They then have someone translating it in their native language in a way to help them understand. But the concept is still something that they have no idea what we're talking about. So what we have done is translated those forms in those 3 different languages. They will not be filed in the public record because all of our actually filed documents must be in English, but it will serve as a guide in order to help them understand more about the process and exactly is what's happening. And so we are very excited about that. I mean, we've had situations where individuals who don't speak English, who are from other countries, will say, I didn't understand what this was when I pled to a felony. And now I can't get a job and I can't live anywhere. And what happened here? And it's not something that we can go back and erase. We can't say you no longer did this. I mean, unless they have the opportunity to have the offense sealed or expunged from their record. But at that moment, they just thought, I want to get this over, because that's another difference from our system as compared to some other countries. They never want to come to court. Granted, nobody really ever does. But, it's just a different view of the government and a different view of the system. And so they're doing the best they can to get this over, not understanding that this felony can impact you for the rest of your life. And I made my little notes just to make sure I didn't forget anything. I'm also very excited. This year will be our first year that we have the Justice for All Youth Summer Camp. So I started during the pandemic with Judge Dan Hawkins, and it was a virtual program that we offered to middle and high school students throughout Franklin County to help them learn more about the justice system. And so that's from the civil side and from the criminal side. This year, it will actually be in person. We will be able to serve up to 40 young people during a 1-week program. We're going to be partnering with the Ohio State University Morris College of Law. So I'm super excited about that. Young people are just really close to my heart But I think that this is a way to continue to improve on our next generation and to give them the skills and the tools that they need, that if they are to become lawyers or judges, that they view things in a way that is justice for everyone and not necessarily just us in a negative or positive way.
How it works.
It's more just a teaching tool to show them how it works. But I have found that a majority of them are young people who want to be in the justice system, either from like law enforcement all the way up to judges. But we do have some who their parents say, you're going to do this because I want you to learn. Because honestly, I believe the more educated you are, the less inclined you will be to enter into the system. And if you do, you will at least understand what's going on. Because when I have 18 and 19-year-olds in front of me, and I, again, am telling them about a jury trial, and they're looking at me like, what does that mean? And I'm asking them, so are you giving up that right today because you want to take a plea to this felony? And I can see them looking. And one time I actually said, we're going to stop. I'm going to Google a YouTube video for you to watch. And it was like movie time in my courtroom because I wanted this young person to actually see it. So I found it was like a Schoolhouse Rock type video. And we all watched it. And so after it's done, I said, now do you understand what's going on here? And so for me, it is going to be a teaching tool. And hopefully we can continue to just grow on the skills and the tools that our young people have, and that they can share them with their peers too.
Can we take questions at the end? Oh, thank you.
And then I'm almost done. So, and then the last thing that I want to do is really encourage all of you, if you are summoned to serve on a jury, to actually answer that summons. And you may wonder why. Why does that matter? Because your perspective, your life experiences can make a difference for a defendant who is there for a criminal trial. And I will say that a lot of times, no, let me not say a lot of times, there have been times when people of color have been called to the jury. And so we go talk to them, or they're like in my courtroom and they're like, I don't want to be here. This is none of my business. And a lot of it is because of the way that the justice system has impacted their life or impacted communities of color. So I understand that they don't want to be here. They may have personal experiences that they feel that they weren't treated fairly. But I challenge you to think how you can make a difference for this individual who's sitting over here, and so that they don't have this same experience. And so we need to have juries that reflect not only by representation in our communities, but by the, again, life experiences and all those different things in order to ensure that, and it's not just a criminal defendant, it can be in a civil case. Both of those parties have a jury of their peers who will come together and make a decision. And I always tell my juries, you are 12 amazing minds. Your decision is as good as what my one mind can make. So don't ever question your decision. You have all done a service to this community. You have done a service to the individuals who are in this courtroom. And I just really, really encourage you to serve on a jury if you ever have the opportunity to do so. And after you serve and you're caught, you don't have to do it again for 2 years. So you kind of get out of it for a period of time. So that's all that I have to share. I will take any questions that, let me do questions now or?
Take a couple now and then we'll take them after.
Okay.
How are those 40 positions or that amazing opportunity given out or found out about?
So we're going to do an application process, what we've done before. The applications are not out yet, but we typically do it through our social media. So it'll be like my Jaiza page or Judge Dan Hawkins. So just kind of follow us on Instagram or Facebook. And once we have everything ready, then you'll be able to see them. But I can also make sure that Senator Tavares has the information as well to enter, however they disseminate information, can send it out to everyone. Absolutely.
Any other questions before we?
Yes, I believe Ms. Jones here.
Do you happen to know like how they determine who gets like jury summons at all, or like what's the criteria?
So the question is, how is it determined who gets a jury summons? So it's through the voting records, voter registration, and through your driver's license. So as long as you're registered to vote or you are a licensed driver in Ohio, you can possibly be summoned. Any other? Yes, ma'am.
Question. Sorry, of course.
but I appreciate the fact of the population by having that quality program, because our youth age by misunderstanding the criminal justice system. Oh, I can do this, I'll get out because I was doing it. Or do it this time because I already did it. You'll get out, you know. So providing that understanding that this is real life and allowing them to understand those consequences at an early age and how it will impact the longevity. So I think that is very good. I hope to see it between pipeline throughout our Columbus community, because our males and now women, now you're seeing the young girls just at a ratio at the same as the males. It's due to that lack of understanding or what they have seen they brothers, sisters, or uncles in those spaces and how their outcomes was. If I get out, you know.
Absolutely, and that's a great point, because a lot of people do believe because I'm a juvenile, there won't be any serious consequences. But another thing that they don't understand is if you commit a felony as a juvenile, that can stay with you for a period of time. And there are certain offenses that are not sealable regardless of how old you are. And it can impact your ability to get a job. It can impact your ability to have a weapon. And so at the age of 19, they think, oh, it's okay, I can have a gun. And then they get a weapons under disability charge and they're wondering why. And it's because of something that they did at 16 years old. And people will tell you, you're a kid, so if you do this, you'll be okay. I have it's a young person a juvenile bindover, who's turned 15 since he's been in jail. And, you know, facing very, very serious allegations. And at some point, regardless of how old you are, that judge has to look at what you're being charged with and how best can you be, in a sense, possibly rehabilitated through the systems that are available. But thank you, everybody.
Thank you, Judge Page, and thank you for all the information that you're providing, not only for us today, but also your educational program for young people, because I think you're absolutely right. This is going to help educate young people on the system itself and how you can keep from getting involved in the system. And going back to this notion of a justice system that is reflective of the populations that we serve, that we're a part of, do answer the call. I've served on a grand jury and I've served on a common pleas court case, and they were probably 20 years apart, but they were rewarding. But it also opened up my eyes that, you know, you're making a decision in the felony case. It was a murder case. Thankfully, I didn't have to make that decision because I was an alternate, but it opened my eyes up. We even went to the scene of the murder. It opened my eyes up into why we as residents of a community need to be involved in the criminal justice system. And if we're called, we should serve, because you do want a jury of your peers and people that do come from all walks of life, that are reflective not only of the defendant, but the victims in the cases of those that are against another person. Our next speaker, and in between, I do want to introduce some of my team members who are here today, because none of this happens without the team of Primary One Health. And so I want to introduce Nicole Gomez, who is in the back, and DeWitt Harrell, who is way in the back. I know Andrea stepped out, so when she comes back in, Andrea Wilson is our Chief Community Services Officer. She'll be stepping out here in a sec. And DeWitt Harrell is our Chief Financial Officer. Nicole Gomez is our Chief Patient Experience Officer. We are a federally qualified health center, for those of you who do not know. And we couldn't do any of this work without our board members. We have 3 of our board members who are here today. Our board secretary, Dr. Mary Bynum, who is right back there. And then we have Erica McGriff, who is one of our board members right here in the front. And then we have Jennifer Beard, who is our chair-elect, and she is back there. This is Andrea Wilson over here, who is our Chief Community Services Officer, which she also has our behavioral health services under her purview. So we have a great team. And then today's event couldn't be done without Susan Brewer, who is our Manager of Development and Marketing, and our public relations social media kind of specialist, Grace Hall. You've seen her come up here and make some adjustments. And then I know we have one of our quality staff team members, Yvonne Banks, who's with us today, and we really want to thank her as well. Again, we couldn't do any of this without our team members, but also our partners. As I shared, Franklin County Public Health has been a sponsor of today's event. I want to thank our county commissioners. I know that Commissioner Boyce has planned to be on our virtual viewing of today's event. Commissioner Crawley had planned to be here, but unfortunately, she had another commitment that she thought she was going to be able to stop by here before she went. So I just wanted to share that information. We talked about a lot of issues around housing. We talked about issues around needs of residents of our community and why some people get involved in the justice system. We've got some materials, some resources in the back that I really would like you to take and share with other people in the community. I know that Kathleen Bailey, as an area commission member, has always provided information to the community. And I think it's very important that we as residents take whatever information we can. There's some wonderful housing programs. Housing is a critical issue right now. Affordable workforce housing, Homeport, and I happen to be a board member of Homeport, provides wonderful opportunities not only for financial literacy education, but also the home buying experience and how to keep from being evicted. And so there's information back there on that. Food insecurity is a serious issue amongst residents, even people who are overweight. People think that, oh, they don't have any problems, they have plenty of food. They can be malnourished. We have lots of older adults who are malnourished or that are dehydrated because they're not drinking enough liquids. And so we need to share information about fresh produce. We have some fresh produce markets that are coming up. But I want to introduce our next speaker, Chenelle Jones. She's a PhD and she's the chair of the public safety programs at Franklin University. So Chenelle, if you would come on up and you can introduce and give some more background information on yourself, I'm going to allow you to do that. Let's give her a round of applause.
Good morning, everybody.
Good morning.
How y'all doing? Yes, that is great. I was like, yes, we start the morning off here at Way Down Yonder Cafe. They got great beignets. So I don't know if y'all have had any yet. You should definitely try some. So for those of you who do not know me, my name is Dr. Chenelle Jones. I chair the public safety programs right across the street at Franklin University. Dr. Bynum, who sits on the board, is my colleague, my good colleague. And so I am so excited to be here with chairing the public safety programs at Franklin University. That means I lead the Criminal Justice Administration program, our Emergency Management and Homeland Security program, as well as our Public Safety Management and Leadership program. And we also have a Center for Public Safety and Cybersecurity Education, which I lead as well. So I am really excited to be here. I had kind of like a broad topic of what I'm going to talk about. So I'm going to start broad and then I'm going to narrow it down a little bit. Is that cool? Okay, you know, she's running things. So I just want to make sure I'm good. And so I want to start off with just a little story. We got what, 20 minutes? We got 20 minutes? Okay. Checking this clock right now. All right. So I'm gonna tell you all about a little story and then we're gonna bring it home. So I'm gonna take you all back to around 2011. And I'm not sure if you all have ever visited New Jersey, but we're gonna step outside of Franklin County in Columbus, Ohio to New Jersey. And around 2011, there was a young man there. His name was Robert Peace. I'm not sure if you all have heard of Robert Peace, but Robert Peace was, he grew up in what we would call a lower income neighborhood in East Orange, which is on the outskirts of Newark, New Jersey. And he lived with just his mother. His mother worked a very low income wage job. As a matter of fact, she was making about $15,000 a year. And so the odds automatically were stacked against him. He had very little interaction with his father. And eventually his father was incarcerated due to murder. And if you want to Google it, you can Google this young man again. His name is Robert Peace. Robert Peace then went on because his mother knew some people and people believed in him. They sent him to a private school called St. Benedict's in New Jersey. And that is a very prestigious school. Most students who go there go on to an Ivy League college and they receive a great education. So Robert Peace was navigating his life. He was in the lower income area. He knew his father was very popular and notorious for being a drug dealer in that area. And so he already had this reputation following him wherever he went. So he went off to this private school and he started doing water polo of all things, okay? and you never really hear of Black people doing water polo, but he played water polo because he was at a private school and he started excelling very, very well and doing great at water polo. Somebody saw him, it was a bank executive, and they said, this young man has promise. He has great potential. And he said, and Robert Peace kept his grades up. So he ended up getting a scholarship to go to Yale University. So he went to Yale and this bank executive paid his tuition, the sum of it, for him to go to Yale University. But what do we know about college? You can take a person out of a low-income neighborhood, you can put them in college and give them all the resources, but what happens when breaks come? They have to go back home, they have to go back into that neighborhood, and they have to revert to what they know in order to survive. Sometimes we call it code switching, but this is what Robert had to do in his real life. So he was living this dual life. These two personalities. At home, he was really popular. Everybody knew that his father was one of the dopest drug dealers out there, that he committed murder. So he had this reputation. Then he would go away to school. And at school, he was wiped into this Yale prestigious university, but he never quite had this sense of belonging and connection to the university. And so while he was there, he started selling drugs. And so he made around $100,000 selling drugs at Yale University of all things. And so he went back and forth. But he ended up graduating from Yale. But what happens when he graduated? He goes back home. And when he gets back home, he again gets sucked up into this life of living up to his father's reputation, selling drugs and doing all these things that are basically illegal. So on, I think it was around September or something of 2011, he was doing a drug deal and the drug deal went wrong. He was only 30 years old. And this guy who had eventually traveled the world because he went to Yale, he did a study abroad program in Brazil. He went back to his high school and taught. He majored in molecular biophysics and chemistry, all the promise in the world, sucked back into this life of selling drugs. And so one night a drug deal went bad. And people broke into his home because they knew he had money, they knew he had drugs, and they forced him down into the basement. And when they forced him down into the basement, they told him, get on your knees and don't face me. And so they ended up shooting him point blank in the back of the head. And that is the short and tragic life of Robert Peace. There is a book written by his roommate, his college roommate named Jeff Hobbs. If you haven't seen the book, if you haven't read the book, I encourage you to read it. It is phenomenal. But what it does is it tells us a little bit more about the criminal justice system and how those who are justice involved and those who get connected to crime and drug dealing and violence, how they need more support than just a financial scholarship out of their life and out of their community to go to college. They need more than that. And so what I am here to talk a little bit about is what that more looks like, how we can support justice involved individuals, not just holistically, right? Because there's education, there's finances, there's housing that you mentioned, there's all the programs that Judge Page had mentioned earlier, but sometimes people need a little bit more. And I'm also going to narrow down, because this is Primary One's event, to talk a little bit about healthcare in the justice system as well. But when we look at Robert Peace, what he needed was also mentorship. What he also needed was coordinated case management. What he also needed was some support. What he also needed was some people who look like him, who will wrap their arms around him and love on him and let him know you are better than what you have done in the past and you have promise and a future. That's what Robert Peace needed, in addition to all of the other things. And when we look at people who are justice involved, that is some of the things in addition to all of the structure that we have. And so I want to talk a little bit about what is a justice involved individual. So justice involved means somebody who has had some kind of interaction with the criminal justice system, moving from police to courts to corrections. Remember, the criminal justice system operates in a linear fashion. There are subsystems of the system, and then there are even suburb systems and those integrated in each of those systems. And so I want to talk a little bit about promising healthcare practices for justice involved individuals. So when we think about people who have spent some time in jail, has some kind of contact with the criminal justice system, police, courts, corrections, and that includes prisons and jails, youth correctional facilities, and all of those things. There was a study that was done by the Urban Institute, and you can look it up and Google it if you want. And they talked about the rate at which people who are involved in prison have healthcare issues. And I'm going to talk about some of this stuff. So people who have been in prison have 4 times the rate of active tuberculosis found in the general population. They are 9 to 10 times, they have 9 to 10 times the rate of hepatitis C, 8 to 9 times the rate of HIV infection, 3 times the rate of serious mental illness, 4 times the rate of substance abuse disorders. And so all of these things are healthcare issues. And we know our criminal justice system, when people get into corrections, jails, and prisons, we know we have that law that says we cannot provide cruel and unusual punishment. So that means that prisons are supposed to provide those who are incarcerated with healthcare services. But what we know is that sometimes they don't get it, it's not adequate, and it's not the best. I'll talk a little bit about that later on. But when we talk about these jail populations and we see these prevalence levels that I just talked about, those rates, they have been increasing over the years. And so what that leads me to believe is that not enough is being done to support those who are justice involved, who have been especially incarcerated. We need to do more. And so studies have repeatedly shown that when we do have people who are incarcerated and when they are released from institutions, they often face disruption in their services that even disrupt the medical care and treatment that they have had. And this can lead to recidivism. What is recidivism? That means they are re-engaging in crime and recycling back into the criminal justice system, maybe even reincarcerated again. And that means drug use also increases. And when we think about these poor and costly health outcomes, that leads those who are justice involved, especially those who are incarcerated, to have a higher risk of death as little as 2 weeks post-incarceration. So these numbers are staggering. And that lets us know again that more needs to be done to support people who are involved in the justice system, and especially those who are reentering in society. One of the things that we know is that most people who are incarcerated, they are going to be coming back out. They are going to be your neighbors. They are going to be your colleagues and co-workers. They are going to be in our communities, in their communities. It's all of our communities. And so there needs to be systems and processes and things in place to support them. I want to talk about another study that focused on returning citizens here in Ohio as well as the state of Texas. And they found that within 10 months of release. A fifth of them have been hospitalized, and a third of them have sought care in emergency room for some kind of treatment. And so again, evidence has consistently shown that connecting people who are justice involved to healthcare coverage and helping them within the community increases their likelihood of flourishing and thriving and doing well, and it prevents future recidivism and negative health outcomes. And so it is really, really important that we lean into it. And so this is why I applaud the work of Primary One and so many other healthcare organizations that are doing the work, because we know it needs to be done. One of the biggest impediments, and many of you probably know, is Medicaid, because a lot of people who are coming out, they are typically unemployed, they are typically uninsured. Once they are released from prison, this means that they are technically eligible for Medicaid, and so they should be able to get it. So then that means we all have to make a strategic effect and impact or attempt at trying to ensure that they receive Medicaid that they're signed up for. So what does this mean? Most people, they might not have an ID card. And so how do we support our returning citizens to ensure that they get an ID? I know one of the things that some cities have been doing is implementing municipal IDs. The city of Columbus has not done that yet for whatever reason, but there is a need. There are a lot of people who can't get basic needs and services simply because they do not have an ID. I know the Bread Coalition had put this whole One ID initiative forward that they had been working on, and it kind of fell off, or I don't know if they're still doing it, but I think there is an opportunity for the city of Columbus to look into what would the benefits be of implementing a One ID or a municipal ID. Cities like Detroit have done it. Cities like Chicago have done it. Cities like New York City have done it. And so Columbus is kind of like an outlier because we are one of the largest cities in the United States. However, we do not have an ID program. And so when people don't have an ID, this provides another barrier for them to receive the necessary and adequate services that they need to get things like healthcare and stuff like that. So I want to talk about that. So the other thing that we find is that once people are reintegrating in society, another impediment to healthcare is just simply like maybe not even knowing about nutrition and health, taking care of their health and engaging in exercises. So, classes and things, and there are some in the city, Nationwide Children's has a couple of classes where they teach people how to adequately prepare your food and healthy meals. Grant Hospital does. I sit on the board over at Grant. They also have a program when people want to come and just learn how to prep healthy meals and things like that. But we need more community organizations stepping out and providing these type of services. It could be a Saturday where people just learn there's other ways to cook chicken. You don't got to always fry it. You can bake it. You can saute it. You can put it in the air fryer. It can still get a little crispy, but it tastes good, but it's a little bit healthier. And so just providing those opportunities to just teach people, because some people don't know. Access to fresh foods. One of the things we know about the city of Columbus is there are areas where there are food deserts. And so letting people know where they can go get fresh produce. We know there's the fresh produce market or People's Produce off of Parsons, not too far from here, that people can go. But people need to be aware of other areas in which they can go get fresh produce. Then we think about, okay, you're prepping, learn how to prep the food, providing healthy foods and services, but then also, what about employment opportunities for returning citizens? One of the things that we know about people who are returning or people who are justice involved is that once you get that, I've been arrested and incarcerated or something like that, you get that label, that stigma that is right attached to you, and then that follows you everywhere we go. So our job, that means all of us in this room, and I'm sure we've all already been doing that work, is destigmatizing the label that coincides with justice involvement and incarceration. Because I just spoke at Richland Correctional Institution last Thursday, right? They had like a Women's History Month thing, and so I went and spoke there. But let me tell you something. So I think it was a level 1 and level 2 facility. So I go and I do this keynote, and it's all men in the room, and it's like hundreds of guys in there. And when I was in there talking to the guys, they came up and they introduced themselves to me afterwards, right? Let me tell you, within about probably 5 to 10 minutes, I met attorneys, I met a whole band, I met doctors, I met social workers, I met all kinds of different professions within that one setting. So there's skills there. And so we need to lean on that. As a matter of fact, I even met, you know how they had a prison attorney, a prison lawyer. So he came up with his folder and all of the cases that he was working on. And so I was like, you know what, you got a really good skill. I met one guy who was incarcerated for 34 years. 34 years. And as a matter of fact, he was getting ready to be released in May. And so he came up and he was talking and he says, Dr. Jones, I'm getting ready to be released, but I'm a little bit nervous. And I was like, well, why are you nervous? You know, and he started talking about the stigma. And that stigma follows a person. And even though he was as nice and as approachable, I don't know what awaits him once he leaves that institution. And it is on us, society, to be welcoming for him because he's already paid his debt. 34 years is a debt. That's the punishment. That is done. We don't need to repunish a person once they come back out of an institution. And so, you know, I looked at this guy because here's the other thing. This guy was like a jazz band. I was like, oh, y'all got like a jazz band over here in Richland Correctional Institution. And so he was the keyboardist, right? And he's just up there just vibing out. And I was like, you know what? There is a career. I was like, you know what? A producer might find you. All you got to do, bruh. I told him, I was like this. All you got to do is find somebody and get you on TikTok. You get on TikTok land, you know what? Somebody's going to discover you and your career is going to take off. 34 years does not mean you don't have a future in music. And so he was like, I appreciate that. I was like, okay. And so, you know, we need to take that approach when we are considering people and those who are justice involved in returning back into society. And so I am actually right at 20 minutes. I don't want to go over too long, but I also want us to think about some other things that need to happen. When people are justice involved or when they are incarcerated, one of the first things that they lose is connections with their family. And when we think about they're going to come back into society, then the reunification process needs to start happening prior to their release. And so organizations need to be able to help facilitate that. And that might take a coordinated effort because we got to think about transportation. We got to think about what the family dynamic is at the time. We might need to think about case management, and we got to get all parties on board with doing it. But there are ways that it can be done. And the other thing is the two most key elements of determining if somebody is going to be successful post-release is employment, well, actually three: employment, education, and their family. And so we need to be on the forefront of ensuring that we build structures and systems and processes, and we have them in place for people who are justice involved and when they are returning. And so with that, I am over my time, actually. So thank you all for having me.
Thank you very much, Dr. Jones. You did a wonderful job. I just want to ask all three panelists if you would come up here and then have the audience ask some questions.
So who wants to start? Yes.
I think it kind of hits on everything who all spoke to. I work for Care Source. We recently had Freedom a la carte come and speak to us. It was very eye-opening because there was a lot of senior leadership in our story. And I think one of the things that, you know, connected basically Dr. Jones on what you just said, the support after. And for those of you that don't know, Freedom a la carte, they are like women who have been in sex trafficking. Most of them have been incarcerated or substance use disorder. The young lady that spoke to us is over the Butterfly program. And what she mentioned was the reason why the Butterfly program was even started. The program initially was 2 years. And those women didn't have that connection and support after the program was over. So it was still important for them to continue to get that support, to continue to get that people that they can connect with and talk to. Even some of them didn't even still talk to their family after they were out of the program. So that was that connection just to someone that was like family, that understood them. And the other thing that they mentioned was just some type of therapy. And it's, you know, it's thinking about healthcare, substance use disorder. She had healthcare issues that came from continued substance abuse that she never knew. She had like 2 or 3 major heart surgeries. So those are the things that, you know, I'm just thinking about everything that you're mentioning. And there's, of course, how they have to continue to connect for a lifetime. So thank you all for sharing.
And anybody want to respond?
Yes, I think the
Come on.
continuity. Sorry.
Because there are people online.
Yes, hi people online. You, yes, so to your point of making sure that people have what they need as they exit, I think that goes back to what we were discussing too about that continuity of care that hits on all social determinants of health that are necessary from day one. Again, the best reentry is really no entry at all. But when we do have them in a space, we want to make sure that there's a wraparound that's provided. Our office actually works again closely with the sheriff's office and our state prisons to have what we call a rapid resource center that is actually co-located at the jail on Jackson Pike. So when a person leaves out one door, they can come into the next door and get everything from a hot cup of coffee and a hug to service linkage. And so it's a true wrap where we help with getting birth certificates, IDs, making sure that working with CODA, that you can actually get back onto what I call the grid of the city safely. People have lost their lives walking down Jackson Pike and getting hit by cars or frozen to death because they can't make it to their next point. When people are booked into the jail who indicate homelessness, now we have a housing program that supports their rehousing and supporting them along that continuum. And so the goal is just making sure that, again, we're doing the things that we need to do because it's intentionally intended for people to be able to thrive rather than just survive. If I have you from day one, there should be a mechanism in place to where we're following you through this process. So the in-reach that we do and the success of the Rapid Resource Center, we're actually building a brand new Rapid Resource Center that is attached to the new James A. Carnes facility out on Fisher Road, because we want to make sure that access to care, all pillars of care, is there from day one and of course prior to release. So that's absolutely important and critical. Yes.
Anyone else want to respond before we take another question? And please keep your questions short so we can get as many in as possible.
Thanks for mentioning. You speak up a little bit. Sorry. Thanks for mentioning all the wonderful programs and everything. And at this point, I can tell your work for purpose and passion. But like you mentioned, you grew up in Linden. So you're a member of the community, but you are now an adult. You used to be a child, you know, in the Linden community. So as you do this work and as you see the staggering numbers, what do you do for, how do, as we do the work, maintain our own mental health as we try to do this work? Yourself in this community, still self in these cases, you know, what about how organizations can help us with our own mental health?
You kind of summarize.
Yes. So the question is, how do those of us who are working in these different areas, and I would include community activists as well, who grew up in the environments that we are now trying to change, what do we do for our own mental and physical health? And for me, my faith is very important. My family is very important. And these resources and these women up here are important to me because we are able to talk to each other. We can sympathize and empathize with each other and ask, you know, for advice on what do we do. And I would say that going back to, I no longer live in Linden. I live on the east side of Columbus, but going back to Linden, sometimes it hurts because I see that in some ways it's grown, but in some ways it has not. I still have a grandmother who lives in Linden, who there was a drive-by shooting and the bullet missed her house, but got her neighbor's house. And so I think about what can I do to make sure that my grandmother is going to be safe when she goes to bed at night. And so those are things that impact the way that we think and the impact that we serve. But I would say is surrounding yourselves, and particularly for community activists too, because we have seen, unfortunately, some of them have taken their lives because of the pressures of the work that they're doing. It's surrounding yourself with people who are like-minded, but also those who can help you be healthy. And if you need help, go find that help. We have to destigmatize this thought that going to talk to a therapist, it means that there's something wrong with you. No, you're going to talk to a therapist because you've realized that I need someone to help me think through these problems. So we have a lot of resources, I think, in our community to help. It's just really finding them and activating them and just staying true and grounded to the work that we do, knowing that I want to change the world. I probably won't change the world, but I'm going to do what I can to ensure that when I leave this world, there will be some change that was made.
We've got some online questions.
Just try, really quick. I just want to say thank you for all the work you guys are doing for reentry under capabilities.
Yes.
I've been working with her for a long time.
I can open it on that computer.
That'd be great.
That I talk about in other states
Yes.
as a really
It's a model. Yeah.
model.
Yeah. Yes. Thank
for
you.
meeting them where they're at.
Absolutely.
Sure.
And Caitlin is phenomenal. And I'll let you all know too, shameless plug before my team jumping. It is reentry, it's second chance month. And so this whole month, we're pushing the education, the toolkits, the resources for what it is to support our returning neighbors, and what it needs to look like again prior to and after that time. So yes, thank you.
I'm going to take a couple questions from our online individuals. This question comes from an individual that says, as a healthcare practitioner, I often see patients whose health is impacted by inability to get a job. What is the criteria for someone to get their record concealed or expunged once they serve time and it's been a long time? How can healthcare practitioners support this?
Well, it's not going to look at me. And that's great because I wanted to make sure I shared this too. There are really two things that can be done. You can seal your record, and we actually call it seal it in Ohio, but the more common term is expunge it. But there are only certain offenses that can be sealed. So those are typically F5s, F4s, and F3s, misdemeanors as well, but it's only a certain number too. The legislature changes that statute all the time, so I always encourage people to keep up with the law. But the Legal Aid Society of Columbus, who healthcare providers can refer their patients to, has a program where they will help anybody figure out if they can seal their record. Also at the Franklin County Municipal Court, there is a self-help center, and you can go there as well, and they can at least help you fill out the forms. It's different forms for misdemeanors versus felonies. They cannot provide you with legal advice, but they can at least help you put down the right stuff on the form. There is a filing fee. If your patient or your friend is indigent, typically those fees can be waived. For more serious offenses, which are F2s and F1s, those cannot be sealed according to our laws right now. Also, offenses of violence cannot be sealed. So even if you have a domestic violence that was a misdemeanor, that cannot be sealed. What you can do though is apply for a CQE, which is Certified Qualification for Employment. And what that does is it gives you a certificate that you can give to your employer in order to show that the legal system in a way has certified that I'm able to work here and that I would be a good employee. Typically it's used for those who need some type of licensure. So I've done that for individuals who want to help aging residents, those with disabilities, also in the healthcare, and sometimes children, depending on, like Columbus City Schools has some positions that they will allow you to work in if you have previous convictions. And so we, again, go through this process. There's a hearing, and then we will allow them to have the CQE. That is available actually on the Ohio Department of Rehabilitation and Corrections website, but that's another resource as well, because a lot of times they think there's nothing that I can do, but those CQEs can be very beneficial.
I think there's two answers. I've got another question. This Minister Londell Town seeking creative ways we build back feeling safe within our communities and seeing how we can go without getting arrested again. Anyone want to comment on that question? Is there a way to do that?
I guess I'm trying to understand. You want to say this one?
Creative ways we can build those space, those safety within.
Not arrest our way out of these issues. All right. So one of the things that we know about public safety is that it's something that we have to co-create in our society. We can't lean on law enforcement. And as a matter of fact, a lot of states and cities have taken some creative ways in terms of co-creating public safety within those communities. And that means perhaps sending out a mental health worker to a call rather than sending out a CIT officer, because the mental health worker might have years and years and years of experience. But there needs to be resources in place to do that. And so, like, I'll give you an example. I had a student a couple of years ago, and we're actually working with him now, who works with the Franklin County Sheriff's Department. And so we did his capstone project looking at their mobile crisis unit. And one of the things that he found out is that they only have funds to send out the mobile crisis unit during first shift. And so people have crisis 24 hours, right? And so, what he did was he worked out a way to restructure that mobile crisis unit. And I don't know if you all know what a mobile crisis unit is, but that is when two officers go out, but they also send out a mental health worker, a mental health clinician to respond to a call. So the officers ensure that it's safe, but the mental health worker actually goes in and assesses the person and then provides them with some care or connects them with resources and things like that. And so that is one way, is to increase these mobile crisis units. Law enforcement agencies and police departments have that CIT, and the CIT, they only get a couple of hours of training and then they go out, but we have mental health workers in place. The other things is that we need to look at the types of crimes that happen. So within Columbus, we know that there has been a spike in gun violence in our cities. We know the ages of people who are engaged in gun violence in our city. They tend to be 20s and lower. And so they're the younger age population. As a matter of fact, we recently I have a program called the Teen and Police Service Academy. We pair police officers with kids in the schools, and the officers mentor the kids. We had a graduation last week, but we had to push the graduation back. Why? Because one of the kids was murdered in middle school. And so that is a problem that we have within our community. But how do we stop that? How do we not arrest our way out of it? Is to provide more programs and the services and address the root cause of what is causing violence. What needs are not being met? How can we look at Maslow's hierarchy of needs with the people within our community and assess what is not being met and provide that and meet that need so that they do not have to resort to violence? How do we provide more conflict resolution to our kids and within our schools and the community, so you can know that there are other ways to solve an issue rather than picking up a gun or resorting to violence? How can we talk out the issues that we have? We need more programs and structures in place. And I see Cecil over there, and I know he's involved with the Ministries for the Movement, and they do the marches and all the work on the south side of Columbus. But we have some initiatives. We have We Are Linden on the in the north side of Columbus, and we also have some initiatives on the west side as well as the east side. Yeah, I'm going to get all four corners of our city. But how can we coordinate those efforts? How can we provide, well, the city needs to provide more funding to support those efforts and initiatives, but not only that, we need to look at what is working, what is not, and we need to fund what is working and stop funding what is not. And we also need to put metrics in place so we can measure the success rate and come out with some true goals, rather than just saying, I like you and I'm going to give you $100,000 to start a program. That's what we need to do, so we will not be arresting our way out of these issues that we have in our city.
Thank you, Dr. Jones. Any questions from the audience before we take it? Yes, Dr. Bynum, can you?
Reality is, don't necessarily. So I'm curious, what would be a comfort way for someone in better understand the rules and
So that is a great question. And so the question is, what can individuals in our community do to better understand the laws so that they do not enter into the justice system? And I would say that Ohio has one of the most complex criminal sentencing schemes, laws in the country. And so do not feel bad if you don't understand it, because there are things that I have to sit and research and try to figure out what it's saying. I mean, for instance, our criminal sentencing for more serious felonies have changed. We used to have definite sentences. So I would tell you on your day of sentencing that you're going to go to prison for 8 years. That has now changed, that you could possibly go for 8 but then you're going to have an indefinite term that could be, so we choose 8, and this is how you get to the indefinite term. So you choose 8, then you take half of 8, which is 4. So now add that to the end, and I said you would do at a minimum of 8, but you could do a possible of 12 years. But that additional 4 years will be determined by your conduct while you are in prison, and I have nothing to do with that. And so that is something that we only explain on some offenses, but not other offenses. But to answer your question, I would say that really some of the best resources are the various public defenders' offices, the Franklin County Public Defender, the Ohio State Public Defender, having forums within your community, whether it's at your church, whether it's through primary care, that the Legal Aid Society or any group of attorneys, private criminal defense attorneys can come out and talk to you and just give a overview of the law. Judges can do that as well. We can't provide legal advice, neither can people who are not your attorney, but we can provide just this general information in order to let you know just generally what things are legal and what things aren't legal, so that hopefully you're not doing things unknowingly, because ignorance is not an excuse to the law, and that you do not enter into the justice system.
Thank you, Judge Page. I guess on that note, that's the reason we have these quarterly community health advocacy forums. We really want to provide as much information as possible to the community. We have lots of great resources in Central Ohio, more than many other communities throughout the state of Ohio, but they're just not known. And as was shared by Dr. Jones, we need to identify those that work, those that are very successful, promising practices, not only here in Ohio, but also throughout the country, adopt those, fund those, grow those, so that we can reduce the recidivism in our justice system. I do want to share a couple of things about Primary One Health. Director Pride talked about the Rapid Resource Center that's at the current the Jackson Pike Center, and it's going to be at the new jail that's on Fisher Road. I've toured that facility. It is a wonderful improvement on what justice should look like while incarcerated. It's a wonderful facility that has all the resources that are going to be located at that facility. Primary One Health and Andrea Wilson and her team, I did see Brian Hall earlier. Okay, well, Brian Hall is one of Andrea Wilson's team members, who is our community health outreach worker that goes to the Rapid Resource Center and provides information to the men. At this point, it's just men at the center, but in the future, even at the new jail, we're going to have the men and women there, so that they can get information not only on Medicaid, but also where they can go to get their health care. It's really important. I just want to go back to the mid-90s when I was a state representative. I belonged to a group that was called the Ohio Legislative Black Caucus, and we were laser focused on criminal justice reform. So I put together a package of 8 bills back then, and we called it our Criminal Justice Action Plan. And we each took one of those bills. Mine was to allow for that tax credit, to have a state tax credit. There's a federal tax credit for businesses who hire ex-offenders. And I wanted to complement that. That's at $4,000 for an employer. I wanted to complement it with a $4,000 state credit. So an employer who would hire an ex-offender could get up to $8,000. Well, the legislature wasn't ready for it. But we had 8 pieces of legislation that really spoke to everything that you all spoke to today. We talked about assessment of everyone going in for substance use disorders and mental health. We had what was called, I think it's a TAP program, where they were correctional institutions that really focused in on serving individuals with mental health disorders and substance use disorders. They had the programs and services right there in the correctional facilities, but all the facilities did not have that. And so that was one of the bills. The other one was, we talked about mentoring. Not every family is good for the justice involved individual being a returned citizen to go back to. Some of the families are not going to help them. They're going to hurt them. And so one of the bills was to allow a church or a positive individual to build a relationship while the person was incarcerated. Because again, you want to have that relationship and someone to help you day one when you're released, and to make sure you're connected to that person while incarcerated. Then we had another one that required education while incarcerated. That one did pass while you were incarcerated, because most people, people think that individuals in the prisons in Ohio are going to be there for long periods of time. The average was about 2 years.
Right.
And so you couldn't, if you didn't have a high school diploma, you may not be able to finish it while you're incarcerated because you weren't there long enough, but you were going to work on your education while incarcerated. If you already had a diploma, you were going to work on a certificated program or start taking college courses. Because what we do know, and stats have proven it, is if you're involved in an education or a self-help program, getting your life together, that the chances of you reoffending are slim. And so that was another one of the bills. As I said, there were 8 of them and a couple passed, but there are still initiatives that should be addressed so that we can look as holistically as possible and to address all the needs of individuals. But all of us have a part to play. And so I would just reinforce to all the wonderful women who have presented today, keep doing what you're doing. We'll do our part to share the information on the programs and services that you have, the ideas that you have, and then we as a community have to be the advocates for these kinds of services and programs to carry them to policymakers, administrators, and funders of programs, because we've got to make sure that the funding is going where it's needed. So if there are no other questions, because I do want way down yonder, beignets and coffee to be able to open to the general public. We've kind of taken away their business this morning, but we did buy food. We want those of you who are here, if you want to buy some more food, to do that. And then finally, I do want to say a thank you, a big thank you to Way Down Yonder for allowing us to come and be here this morning. Leslie, you want to say some closing remarks?
I just would like to close. My heart is so full. I know if Yonder was here, she would feel the same. This is, you ladies are doing some amazing things. Dr. Chenelle, I'm a super, you don't even have no clue who I am, child, but I follow you. I know exactly who you are. Dr. Page, Dr. Page, Judge Page, you are doing some amazing stuff. Just listening to you ladies, I was sitting back there, Yonder always, her vision is always, what can she do to help the youth, especially in the culinary side of it? And so, and then me being a nurse too, and on the mental health side of it. So I was relating to a lot of what you guys were saying for me and for Yonder, the culinary side for her, the teaching side, but for me also with the mental health side and being a victim of somebody, an assault victim. And understanding and just hearing that incarceration side of it and advocating actually for the person who assaulted me to not get a whole bunch of time because I knew he needed to be rehabilitated. So I would love to talk to you guys because Yonder has a lot of, like I said, I told you guys early this morning, I call her a mad scientist. She's not just a genius when it comes to her craft and her cooking. She's really smart when it comes to business and how she can extend herself out to the community. So we are always talking about and brainstorming, what can we do with this building? How can we extend ourselves? Like with me being a nurse, her being a business owner, what programs can we get involved in? I think we actually, somebody actually reached out from a program I think you were affiliated with, a guy that we were trying to get in touch with, where we were trying to get people to come in and just kind of follow her and see how she does things. So I would love to talk to you guys if you have some time. Yeah, please. And thank you guys so much for coming. It was an honor. Thank you so much. It was, I'm so humbled to be in your presence. Thank you so much for being here.
Let's give Way Down Yonder and Leslie and the team here another round of applause. Please come out to Way Down Yonder, beignets and coffee right across from the McDonald's on Main Street downtown. That's how you'll see it. Parking, free parking in the back. You can get your beignets and fruit and oatmeal and all kinds of good breakfast food. So thank you again, and thanks everyone for being here. Please take the material, the informational and resource materials that we have in the back.